And as at now, services still continue, especially in the hospitals, and that being the stakeholders who are most affected given this directive. Well, they're speaking on the issue right now. The Health Workers Union alongside the County Workers Union are speaking on the shutdown of county services. This follows the directive by the COG chairman, Wycliffe Oparanya, to send county staff, at least the non-essential staff, he termed, on leave for 2 weeks following the stalemate at Senate on the revenue allocation of funds. Helen Aura joins us live with some of the union officials and what has happened so far. What can we highlight, Helen?
Well, Mark, the union actually believes that the country's leadership has indeed failed Kenyans. And this is following the ongoing strike by county healthcare workers across various counties due to them, most of them not receiving their salaries. And as a matter of fact, some of the key recommendations that the union has put forward is that the creation of a health service commission and that the county government workers to manage human resources for health employment and deployment of healthcare workers across various counties. And the other thing that the unions want to be addressed is the issue of the National Treasury should be able to release funds immediately in continuing services of payment of the salaries to healthcare workers across the country. And one of the key pointers also that has come very forward and very strong from each and every leadership in the union is that all healthcare workers who have not received their salaries so far should be able to stay home and find other things to do. And this in turn will also lead to many patients in hospitals across various counties not being able to receive treatment or not being able to receive health care, which is quite mandatory or detrimental at this particular moment. And I'm joined by George Kibore from Kuno and Chibanzi Machonda, who will also further be able to address this particular issue. George, welcome. For you to say that healthcare workers who've not received their salaries so far to stay at home, what happens to the patients in hospital?
Thank you, Helen, at least for highlighting about this issue. What happened is that we have said we are, for the first time, in agreement with the employer who says that if we are not being paid to go home. The reason why we are agreeing with them is that we have been suffering for all these years that we have had devolution. And when we raise this issue, they never agree. Now today, for the first time, we agree with them. And we have called all the health cares who have not been paid to go home. Then the other thing that we are saying, now it has a ripple effect, that for the patient who have been admitted are going to be released home. And the patient who are outside might not be able to get the services. That's mean we will have this patient be transferred either to the public sector or any other facility that is available for them, including the Mission Hospital. And even today, we want to caution those who are traveling that they should avoid traveling. We know what happened in our road. This has a ripple effect. And we want to say it is sudden that we come to such a situation, but again say that it is a call for us as the country to ensure that we have a commission, a health service commission, that can be able to look into the welfare of the healthcare workers. And indeed, a awakening call for the Kenyan to get to know that their leaders, their political leaders, do not care about them. Thank you very much.
And does this mean now inpatient and outpatient services will tremendously be affected? So for the normal Mwananchi, the Wanjiru, the Njeri, how will they be able to get some of this healthcare? How will they be able to get access?
I think that is the saddest thing that we need to say, that once we have said that all those who have not been paid should go home, it is a kind of saying that no services is going on. In services, outpatient, all services will be closed down. However, we have said for those who have not been paid, if there is any person who have been paid, let them continue services. Now, that is a awakening call for all the Kenyans to get to know that they will not get services in the public sector where employees, the healthcare workers, have not been paid. So that's to mean we are closing down, total closure for all the facility. And remember, Helen, that we already have strike for the Nairobi, Narok, Homa Bay, and also Baringo, and including Embu, where everything is closed. Thank you very much.
All right, thank you so much. Machonda, maybe can you actually explain for the normal Mwananchi who's watching you right now, it kind of comes off as a bit insensitive for you to say you're going to close down some of these services due to, first and foremost, you know what? You're not being paid, you're not receiving the salaries. But what happens also to the ethics of the medical ethics at hand?
So let me say this first. The responsibility of provision of services, as per the Constitution, lies upon the leadership, whether at county or at national level. So this crisis has not been created by healthcare workers as we're speaking. This crisis has been created by the leadership, which is the national government and the county governments. So county governments are decrying they have no funds. The national government has not taken steps to ensure that the minimal funds to support the healthcare workers are availed. So as a result, it is a crisis by the leadership, not by healthcare workers. For us, even as healthcare workers, we still need to survive. We still have rent to pay. We still have families to feed. We still have relatives who depend on us. So if you're not going to be taken care of the way it should be, and this is not new, it is not the first time that the Council of Governors are delayed, it's not the first time that dues are not remitted, NHIF, statutory deductions, it is not the first time. It has been a consistent and perennial problem. And because of that, the only solution to save that Kenyan who now needs those services is the creation of a Health Services Commission. There's no other solution.
And some of the key pointers that came forward from today's meeting was the fact that there's always money for projects. There's always money for kickbacks, as you had mentioned it earlier, but there's no money to pay healthcare workers. Is that how generally the union feels? Is that where you people stand?
Yes, and I say this because we've been having engagements over the last 3 weeks, and one of the biggest contention we've had is the promotion of healthcare workers. So the rallying call across all county governments and county public service boards is that they don't have money, but they have money for procurement of beds. They have money for procurement of equipment, because that is where, and we know this country, that is where corruption is, in procurement. So the focus on healthcare has been on procurement for far too long. So there's no way you can say there's no money to promote healthcare workers, to take care of healthcare workers, their compensation, their medical insurance, their access to healthcare services. So that is why we are saying that we need a Health Services Commission separate to be able to purely focus on the HR aspect and the welfare of workers in the counties for continuity of service. Yeah.
Thank you. Well, there you have it, Mark. This is some of the key issues that were actually mentioned today, and healthcare workers in the countries right now feel like as if they have been neglected. And following even different countries and different counties, still healthcare workers stating that they're still going to continue with the strike. Back to you, studio.
Helen Naura, thank you very much for that representation.